to know that medical error is not about the perception of the lay people. It's about an expert that should tell that an error took place. An adverse event is an unplanned or unusual deviation in the patient care, while the sentinel event is an event which has resulted in an unanticipated death or major permanent loss of function, okay, not related to the natural course of patient's illness or underlying condition. And it's very important actually to emphasize on the last part of the definition, which is not related to the natural course, because sometimes some diseases, some conditions are by themselves can lead to death or can lead to severe impairment. Like for instance, if someone has renal failure, for instance, and he is being treated for renal failure, chronic renal failure, or even acute renal failure, and the management did not work well, but it's well known that renal failure could lead to permanent loss of renal function. So if this happened, this could be attributed or explained by the fact that the condition itself could end to lead to this. However, when we're talking about the sentinel event, we're talking about an event that is almost completely not related to the care. So the medical error has levels. There are more than one classification, but I will talk about one of them. Level 1, it's an event occurred that resulted in the need of increased patient assessment, but no change in vital signs and no patient harm. That's to say that what you did just only made the patient needs further assessment, but it did not cause any harm. It's not even notifiable by the patient. The second level, it's an event that occurred resulted in need of treatment and or intervention and caused temporary patient harm. Well, the level 3, it goes further, or it goes worse. It's an event that resulted in initial or prolonged hospitalization. Now it's getting more serious because this patient needed hospitalization and caused temporary harm to the patient. Level 4 is that the harm now to the patient is permanent, okay, or near-death events such as anaphylaxis. If you give a patient penicillin, for instance, without testing, without asking the patient and testing for sensitivity. So basically, if this patient developed anaphylaxis, so this is one example. Level 5, any set of circumstances which significantly increase the likelihood of a serious adverse outcome. That is to say that at this level now, it's a set of conditions that could lead to a serious, to increase the likelihood of serious adverse event. Now, level 6 is the worst indeed. It's an event occurred that resulted in patient death. The bottom line here is from level 3 to level 6 should be discussed and disclosed with the patient. That's to say from anything that led to further to hospitalization of the patient up to death, then indeed you need to talk and know about it. So there are some types and examples of medical error. Medical error could be related to the diagnosis or evaluation, like misdiagnosis. You miss the diagnosis or you make a wrong diagnosis. Medical decision making, inappropriate or premature discharge. For instance, you have a patient, you discharge him or her before complete recovery. It could be medical error related to treatment. Like for instance, waiting when treatment is indicated. That's to say the doctor, especially physicians and the internal medicine, they have this slogan of wait and see. Okay, well surgeons like open and see. Waiting is not always a good thing to do. Medications, either the wrong medication or the wrong dose and the incorrect dose. Inadequate supervision, failure to review the treatment plan, especially you as residents, actually, you need to have close supervision, although you are, in a sense, you are doctors indeed. But again, it's important that you be supervised to make sure that you are following the treatment plan. Faulty communication, failure to convey information is also an important aspect of medical error. One would say that if I fail to communicate with the patient, this is a medical error. Yes, it is a medical error because the patient has the right to know. So if you fail to do that, this is a medical error. Procedural complications like faulty technique. For instance, you give a patient an injection and which led to formation of abscess, for instance. the medical decision making, inappropriate or premature discharge, as we said, or even your failure to obtain a consent from the patient. The common causes, what are the causes of medical mistakes or medical errors? Basically, it could be ignorance, but this is not, sometimes, you know, you as a doctor, you're not specialized doctor, so sometimes you don't know what should be done, and you did to the best of your knowledge, but to the best of your knowledge is not enough. Sometimes it's related to the inexperience, because, and again, you as residents should not be go too courageous actually in your decisions regarding medical treatment. Faulty judgment, and again, it's somehow related to inexperience, because you don't have the enough experience and not the enough knowledge to make a good judgment on the case. Hesitation, and especially junior doctors usually hesitate a lot before talking to the consultant or seek senior advice. Fatigue, it's indeed, and it's also related to the job overload, where sometimes you just to be on call, and the day after you have many activities to be done, etc. So it's basically the fatigue and job overload. Sometimes the concentration, your concentration as a doctor diminishes for some reason or another. Faulty communication, again and again, communication comes to be a very important thing that you as a doctor should be excellent in doing. Most of your practice is dependent on your communication skills. Failure to monitor closely, and again, although usually monitoring is for junior staff and for nurses, it's important to monitor your patients closely. And sometimes it's a problem of the system. For instance, if the system tells you, if you have this patient with this criteria, you transfer him to this department, and that department has a different policy. It said, no, don't accept patients unless they have this and that criteria, and the time is wasted, the patient between this department, that department, this consultant, that consultant. So sometimes it's the problem of the system. But however, medical mistakes or medical errors, actually, errors would happen. We are all humans, and to err is human. Since error can be expected, anything that could be expected, then systems should be designed to prevent them and to absorb them. Errors are not synonymous with negligence. This is different, because sometimes negligence means that somehow you intentionally made or caused harm to the patient, but most of the time, most of the mistakes are unintentional. So this is a very important. Creating a culture supportive of error reporting is the starting point in reducing future medical errors. I think this is very important, that hospitals endorse policies which encourage the clinicians, physicians, doctors, nurses, whoever, to come and report that they come and say, okay, I did that mistake, I wrote the wrong dose, I made this particular problem or that problem. But again, the hospital should be protective for their staff. However, it's your duty as a doctor or a physician actually to disclose the errors to the patients. Notify your professional insurer, and it's, I think, one of the most important, I would say, good trends that the Saudi Commission adopted is that any clinician should have medical insurance against medical errors. Although some would say that, okay, this would encourage doctors to do mistakes so recklessly, but this is not the case indeed. I'm sure that the doctors will do their best for their patient, and this insurance is just a procedural issue just to protect the doctors against mistakes. More importantly, you should communicate well with your seniors and the directors if anything happens. Disclose promptly what you know about the event. Concentrate on what happened and the possible consequences. That is to say, you have to discuss with your patient that, okay, you should have taken, say, 10 milligram of this, but what we gave you is 20 milligram of the drug. This drug had that side effect and that side effect. So, and these are the possible things, and we will do our best not to have this again. Take the lead on disclosure. Don't wait for the patient to ask. It's very important, and it's actually embarrassing. Sometimes physicians try to run away with this, if you like. But at the end of the day, either one of your colleagues or or a patient or a patient relative would come and discover, and at this point of time, to be very embarrassing for you as a doctor that you've been trying to hide your mistake. Outline a plan of care to rectify the harm and prevent recurrence. It's very important, actually. When we're talking about medical errors, it's not the culture of punishment. You made a mistake, you should be sent to the board, you should be suspended, and all this stuff. No, it's more about finding opportunity to improve the health care for our patients. Offer to get prompt second opinions where appropriate. It's your right. If you doubt, if you made a mistake or you doubt that there's something wrong that happened, to find a second opinion or a senior opinion to help you. Offer the option of a family meeting and the option of having lawyers present. Sometimes you may even need a lawyer, but most of the, I won't say most of the time, but it's important to have support from the hospital, to have a family meeting with the patient and his or her family as needed. And sometimes you may need even to include lawyers just in case if they want to go further for the or a lawsuit or something. Documentation, document important discussion. This is very important, actually. That should be reported that this discussion happened about this, because in case the patient or his family wanted to make a to sue you, I mean as a physician, then it's better to have something documented about it in the file. Offer the option of follow-up meetings and be prepared for strong emotion. It is, this is the least you can get. It's usually patients get frustrated, their families get frustrated, strong emotions. How could that happen? You should have been more careful about this. We trusted you, and you may hear some, I won't say bad words, but some strong emotions could be in place. You need to learn how to accept them openly and transparently. Okay, if we want to prevent the medical errors, actually error prevention measures include reduced reliance on memory. Fortunately enough, this trend is now changing. The old trend in medical education and practice that doctors know a lot of information, they know the whole books in their heads, and they rely almost solely and only on their memory. No, you should not. There should be some checklists, some flow charts, some tickler system, so anything that would remind you. Now, especially with the iPods and with the iPads and smartphones, it's getting so easier to find what you're looking for. Improved information access, handheld computers, electronic medical records, error-proofing systems, fail-safe to avoid prescribing two drugs that interact fatally. For instance, it's possible that hospitals, especially those who are working on electronic basis, if the doctor, for instance, prescribe a drug and this patient is already on another drug, so if they, for instance, interact or there's a contraindication, for instance, if the patient is pregnant and you are putting a drug that's not suitable for pregnant women, then the system automatically sends you an error message, and this could help you to reduce the error. One important thing is the standardization. Each hospital, each health facility should develop its own guidelines, its own policies, and should be in place and should be followed by all staffs. Because sometimes some consultants say, okay, you know what? If I have a diabetic patient with hypertension, I treat him with this and that. Another consultant say, no, we in the States, or I came from UK, so we don't do this, we do this and that. So it's basically important, actually, to follow the same procedures and the same guidelines. It's also important for the training of staff on how to identify error and how to prevent it. Thank you.